Okay, so this diagram right here, we're going to continue to go through it with the axilla, but we're going to talk about the brachial plexus now. Okay, so the brachial plexus is basically a bundle of nerves that deviate from the upper spinal cord, C5 through C8 and C1, right? They deviate from the spinal cord, separate, go through all these different divisions, right? And then they innervate our muscles. Okay, so what is it used for? It's the major plexus of nerves, right? I said a bundle, major plexus, for motor, sensory, sympathetic information of the upper limb. Okay, so it's going to do what? Send the signal, right? Sensory receives to the body through what? Afferent with an A, neurons. And then efferent, the motor, is going to send the signal to the body. The signal is being sent to the body, right? And this is how we're going to move the muscle. Okay, so the first thing we're going to do is we're going to talk about the spinal cord, right? I said C5, 6, 7, and 8. And then T1. These are the major ones that we need to focus on in this video. Okay, the spinal cord is then going to deviate into roots. There's going to be 5 roots that the spinal cord is going to deviate into. So let's start here. C5 and C6 is going to deviate together, right? There's 2 roots that have their own root. C5 root, C6 root. They're going to join together and they're going to form the upper superior trunk. Okay, so after a root we have a trunk. There's 3 trunks, 1, 2, 3. So right now, C5, C6, we have upper superior trunk. Okay, good. Now, if we go right to C7, we deviate, or we go right into the middle trunk. He does not innervate with any other vertebrae, he's his own guy. Lastly, C8 and T1, they're going to fuse together to form the inferior lower what? Trunk. Okay, so we have our trunks now. Have our roots. We know all these roots come from their individual spinal cord or vertebrae column. And this is where we're at. Okay, so I'm going to talk about the nerves that branch off of the roots and the trunks after. Let's just try to get through it first. Next, we have divisions. We have 6 divisions. What are the divisions used for? Okay, so I said spinal cord goes to roots, roots go to trunks. So now the trunks are going to deviate, right? Why are we getting more narrow here? Because the body wants to save space. It needs to be efficient. If we have all these wires going all over the place, think of it like cables, it's frayed. A frayed cable isn't an efficient cable. An efficient cable is something that's insulated, a coiled small cable. Something like this right here is going to be like the cords that we're going to have our body run through. We need that. Okay, we're going to deviate at the end like a parachute. Okay, we're going through the upper cords, right? The trunks. The trunks narrow out. But now we have to start deviating. Now we have to start going our own way because we have to do simple innervations. Okay, so the first division, I said there were 6 of them, comes from where? The upper and superior trunk deviates into the ventral anterior. Ventral and anterior is the same exact thing. And then the dorsal posterior, same exact thing. Dorsal and posterior go one in one, hand in hand with each other. Okay, every single trunk deviates into these 2 divisions, ventral, dorsal. Middle, ventral, dorsal. Inferior, ventral, dorsal. They all deviate into the same exact thing. Okay, so after the divisions, what happens? Each division goes its own way and does its own little thing. However, they all meet up again one more time. Remember, efficiency. Okay, so we're going to start off with the top one. We have what? C5, C6, right? The C5, C6, ventral anterior, right? C5, C6, C5, C6 goes together, ventral anterior, ventral posterior. Okay, these 2, right? We're going to talk about the top one first. He's going to flow down, right? And what's going to happen to him? He's going to join with the ventral anterior, right? Ooh, he's traveling all the way through, right? To C7, ventral anterior. Okay, these 2 are going to form together. When they form together, what are they going to form? What do we say what happens with a cable? It's going to form a cord, right? A cord, we have 3 different cords. We're going to form a cord, right? And this is going to be called the lateral cord. Okay. Ventral anterior division from the C5, C6, and then the C7 form the lateral cord. Okay. When I say lateral, what am I referring to? I'm referring to the axilla. So, if I'm saying lateral cord, I'm really saying lateral cord of the axilla. I am lateral to the axilla. And remember, if I'm standing in an anatomical position, lateral is far away, medial is closer to my body. Okay, so this lateral cord, lateral to the axilla, is going to deviate into 3 different branches. What's he going to deviate into? He's going to deviate into the lateral pectoral nerve, which is C5 or C6. Remember we spoke about that in the last video? C5, C6 of the lateral pec, and then we have different vertebrae that do the medial pectoral nerve. So then the lateral pectoral nerve, also the lateral root of the median nerve, he's going to deviate into other things, but we're not talking about that yet. And he's also going to deviate into the musculocutaneous nerve. Okay, what is the musculocutaneous nerve? Muscles of where? We're talking about the upper limb here, the brachial plexus, right? So the musculocutaneous nerve, C5, C6, is going to deviate into the biceps brachii, the coro brachialis, and the brachialis, right? This is all the arms, the anterior muscles of my upper limb. Okay, not my forearm, not my tricep, but my biceps region, anterior of the upper limb. Okay, so where did these 3 come from? We said C5, C7 ventral, right? C5, C6, and C7 ventral, what? Vertebrae. Okay, so that's the first cord, lateral cord, check. The next cord, how is it going to form? Okay, remember I said upper, superior, upper, medial, and inferior, the 3 different trunks? Okay, and all 3 trunks have 2 different divisions, correct? Ventral and dorsal. So now, the dorsal divisions of the upper superior, middle, and lower are all going to come together, right? Right here, and then we come down, right back up, right here, and we're going to form the posterior cord. This makes a lot of sense. If we're in the dorsal or posterior, right? Dorsal posterior regions of what? Of the divisions that come from the trunks, and they all come together, they're going to make the posterior cord. Makes sense. Okay. And this is posterior to what though? It's posterior to the axilla. Remember? I said the cords are always in reference to the axilla. Okay. So now the posterior cord, we have to have a little acronym because it's kind of difficult to remember. We're going to call it ultra. That's the mnemonic. So ultra, the U is the first one. He's the upper subscapular. That's what he innervates. L is the lower subscapular, which is the teres major muscle. Remember we spoke about the teres minor and teres major. Then we have the thoracodorsal muscle. This is the latissimus dorsi. Remember back here, comes all the way up. The climbing muscle. Then R, we have the radial nerve. This is the posterior region of the arm. And then we have the axillary nerve. Okay, so all of these muscles that are innervated come from the posterior cord. The next cord that we're going to talk about is the what? Medial cord. Okay, where does the medial cord come from? It's not going to come from any ventral, it's not going to come from any posterior regions because we could cross all these out. He's gone, we did him, we talked about him, right? We also talked about C5, C6, and C7, right? He's done. He's done. Okay, so the last cord we have to talk about comes from C8 and T1, right? C8 and T1, but posterior is already done. So he comes from the ventral or anterior region of the C8 and T1 division. Okay, so medial cord, medial to axilla. His acronym is MMMUM. Any mnemonic you want, create for it. So the M stands for medial pectoral nerve. The next M is the medial cutaneous nerve of the arm. The next M is the medial cutaneous nerve of the forearm. So, okay, we're going in order. This is all medial. C8 to T1 is all medial. Where is C8 to T1? Okay, it's around here. It's lower than C5 through C7, but it's not as low where it's all the way to the bottom. It's around my chest area, and it's close, so it's middle. So, medial pec, the first one. Medial cutaneous nerve of the arm, second one. Medial cutaneous nerve of what? The forearm. Ulnar nerve. Remember we spoke about ulnar and radius? Where was ulnar? Ulnar was inside, radius was outside. Ulnar nerve. I'm still proceeding lower down. And the last one is the medial root of the median nerve. He's circled though. Why is he circled? Just like the lateral root of the median nerve. I circled him. These two guys are going to form one more division. Their division, they're going to come together. and then him, they're going to form the median nerve of the axilla. So they're forming the actual axilla nerve. So what is this important for? All these guys do are all the flexor compartments of the forearm. So any muscle, you know there's a lot of forearm muscles. We have deep, we have superficial, but it's not any of the extensors, it's all of the flexors, except for a couple of them. One of them we're not going to talk about is the flexi carpi ulnaris. It does not innervate the flexi carpi ulnaris. And also the medial, so remember medial, not lateral, medial half of the flexor digitorum profundus. So something to do with the fingers we're not really going to contract with this median nerve of the axilla. Okay, so we spoke about how everything went. Now I'm just going to, a quick clinical thing. C5 to C6, what did we say it was? The axilla nerve. And what was that? The teres minor and the deltoids. So what happens if you have a mess up with your C5 or C6 vertebrae? Something occurs. You have weakness in what? Lateral rotation, and you have a loss of action in your teres minor. Okay? Now, if we follow down C8 to T1, we have our rope climb injury. What did we say this was? Something to do with the latissimus dorsi. So if we follow C8 and T1, right? We go from the roots to where? The trunks, to the divisions, into the cords, right? And we keep coming down. We can either go posterior or anterior, right? So for this case, which way are we going to go? The latissimus dorsi comes from where? The thoracodorsal muscle, right? So we're going to follow the dorsal posterior division, and we're going to come up, right? And we're going to come up to the cord of the posterior cord, posterior to the axilla, and we're going to find our mnemonic ultra, and we're going to say, okay, which one is going to be the rope climbing muscle? Right here, T, thoracodorsal, latissimus dorsi. So let's look at it backwards. If we got a question on the test saying, which vertebrae is innervated when a person is climbing up a rope and they can't climb anymore? What vertebrae causes this? Okay, we could think about our mnemonic and we could say ultra right here, T, thoracodorsal, right? We could go backwards and we'd be like, okay, it's part of the posterior cords, and we could say, okay, C5 through C8, or C5 through C7, or C8 through T1. We could follow them down all three different ways, right? And we say, okay, for the thoracodorsal though, we have to remember he comes from the posterior region, and then we just keep following to this division, down here, all the way back, and we can say, okay, he could be T1, or he could be C8. So we can remember that for our test, potentially. Next, I'm going to talk about a couple different nerves that come from spaces other than the cords. Okay, so if we follow C5 down, right, we're in a root. Okay, we're in the what? C5 root. We have the dorsal scapular nerves, which are the rhomboids. And then we have the biceps tendon, which is for extension and external rotation. Some elbow flexion as well. Okay, if we keep going down C5, or maybe even C6, we have the nerve for the subclavius and the nerve for the suprascapular. Not bad. Now, if we say C5, C6, and C7, we can remember that this makes the long thoracic nerve. This long thoracic nerve is for the serratus anterior. The serratus anterior does what? Abduction and protraction. What is abduction? Away from the body. But what does the serratus anterior do? It doesn't do the initial. It does from the 15-degree mark to about 90. Some people say 110, but it's to about 90 degrees. That's what the serratus anterior is for. Lastly, C7, right here, innervates the triceps. It helps diffuse function in the upper extremity. That's everything we need to know about the brachial plexus. I know it's a beast, but it's really important to know where everything goes and where everything innervates from, because it's helpful. Stop the video.